I'm Tom. It's my privilege to be your navigator in this discovery module from VisiaQuest. I want to introduce you to this very common condition called age-related macular degeneration. Let's just call it AMD. Before we get going, we'll try to follow a couple of ground rules. Let's avoid medical jargon that's difficult to understand. We'll introduce you to some of the basic language of retina important for understanding AMD. We'll be sure to examine basic eye anatomy so that we know exactly where we are. We'll show you easy to understand illustrations of wet versus dry macular disease. We'll visit with real patients to explore common questions. Okay, let's get started. Here's Dr. C. Joseph Beck, a board-certified ophthalmologist and fellowship-trained retinal specialist.
Hi everyone. You know, I often hear patients confuse the word macula with a disease. So what they mean, of course, is degeneration of the macula. And a great way to explain degeneration is to imagine replacing a highly specialized body part with a scar or a callus. Most people have heard there are two types of AMD, dry and wet. What they don't commonly know is that essentially all eyes start with dry change. A percentage later convert to the wet category. Remember in our definition of degeneration, we talked about replacing specialized cells with material less functional. Well, just imagine replacing topsoil with rocks or tennis balls, anything less helpful to the overlying grass. Likewise, the retina loses function when its supportive pigment layer is disturbed. Well, here's the real thing. This is a color fundus photo of a patient's left eye, and you can see the creamy, yellowish drusen under the macula. When I consider wet AMD, I like to think of a weed barrier damaged by UV light. Stuff I'd like to remain under my topsoil, especially rogue weeds, now mixes with the desired vegetation on top. Visual distortion caused by drusen under the macula is variable, from basically none to moderate. Wet AMD is exponentially worse. Well, I'd like to share what we've learned over the last 20 years of subspecialty retina practice. And we want to build on this tutorial with periodic updates based on observations and suggestions submitted by you. Well, to get us efficiently through the topic of age-related macular degeneration, I'd like to walk you through a series of high-value modules. These include a look at dry versus wet AMD, a review of the common testing procedures that make accurate, individualized care possible, an easy-to-understand presentation on VEGF, vascular endothelial growth factor, the fuel that drives wet disease, a review of both alternative and combination treatment options, a discussion on maintenance therapy versus what is called treat and extend, a review of common eye conditions that often accompany AMD, a helpful interview with a highly experienced low-vision specialty optometrist, in-depth interviews with leading doctors in optometry and ophthalmology, and a thoughtful presentation on the psychologic aspects of chronic disease and important tools proven to make a positive difference for patients and caregivers. And finally, what you really want to know but are unlikely to get from a typical clinic encounter.
Okay, we're at A. Now we need to get to B. What you need is a navigator to help you get efficiently from where you are to where you need to be for best outcomes. Don't expend valuable time recreating the wheel. coached up by others who have already navigated the course from diagnosis to best outcomes. We hope you found this introductory module helpful in understanding the basics of age-related macular degeneration. If you'd like a much more in-depth tool to help you get from A, diagnosis, to B, best outcomes, I encourage you to consider VisuQuest's new 10-module comprehensive series on this all-too-common eye disease. Take an active role. Reach out to others who have navigated the same route. And don't forget, there's hope in knowledge.